So I'm very curious about supplements because a lot of people ask about them. Are there any supplements out in the market that are helpful for sleep right now?
Yeah. So what I always tell my patients is the secret to good sleep is not your melatonin or your 5-HTP or your CBD. The secret to good sleep is the same as the secret to good overall health. It actually comes down to healthy diet, healthy lifestyle habits, and in sleep's case, healthy sleep habits as well, keeping a regular sleep schedule, having a reasonable time in bed, not too little, not too much, all of those having an appropriate bedroom environment, all of that. And if you are doing all of that, your sleep is as good as it can be. And when you're under stress, your sleep is going to be a little bit lighter because that's the normal hyperarousal response. Maybe when you recover from the stress, the sleep will be a little bit deeper. If you've had an enforced sleep deprivation due to excess work or something, the sleep will be deeper. Once you finally once during that period of time, you might have some recovery sleep after, but it's not supplements. So don't waste your time in the drugstore looking through this shelf, looking for the secret to good sleep. The power to achieve good sleep is there within you, and everything else is, it may have a temporary effect, but it's not producing actual sleep. The producing actual sleep requires this intricate orchestra of neurochemistry and levels going up and down and up and down. And so taking a supplement is never going to create that same orchestra that your body creates on its own. And maybe it'll make one stage a little bit deeper. A lot of these things do have effects on sleep, but it's not going to produce good quality, sustained sleep in the long run and going to make you feel better in the long run. Sometimes people are deficient in a nutrient. They have poor dietary quality or a very restrictive diet. And so, if you're missing a certain vitamin like B12, your sleep could be worse, or maybe you don't have enough magnesium, and, taking the magnesium helps. Some people think that helps for leg cramps, but really don't waste your time with supplements.
I love that. The power to sleep well is within you.
Yes.
Yeah. Magnesium is one that I hear about a lot. Why do you think that's become trendy, and what's the relevance for sleep?
So, magnesium is one of those where if you look at the research trials, they show it doesn't really work. But the problem with these research trials is they're small, they're, poor. They always have what's called high risk of bias. Like they're just basically not well done research studies. And so you can't really conclude from those that it works or it doesn't work. Anecdotally, many patients do report benefit from magnesium, either for restless leg, for leg cramps, or for sleep quality. So I don't know. There are certain foods that are high in magnesium. Like there's nut mixes that are high in magnesium. I don't remember which ones go into that nut mix. You can look it up. But maybe we're magnesium deficient in our diet. I don't know. But again, my first line is always look to improve your dietary quality and broaden the types of food that you're eating. And, if you want magnesium, again, go for those high magnesium nuts or, other foods that have magnesium rather than taking the supplement. If you do try the supplement, you find it helpful, then how can I replace that in a more natural way? The problem with supplements as well is they're not regulated, so you don't know what you're getting. So they'll be labeled as one thing, and often even the manufacturer is trying to make that. But like, for instance, with melatonin and serotonin are chemically very, very similar. I think it's like one nitrogen different, or I don't know what the difference is, but they're very, very similar. So some over-the-counter melatonin has actually been found to be serotonin, which we think is just an error that like they manufactured the wrong substance, but you don't even know what you're getting. And for melatonin specifically, they've done some studies where they look at the dose that's reported to be in that supplement and what is actually in that supplement, and like they're just totally different. And even the same manufacturer, different batches were found to contain different doses of melatonin. So it's unreliable. And the cannabis dispensaries as well, most of them are well-meaning, right? Not all of them, but most of them are very well-meaning, but they might say you're getting pure CBD. It might not be. They might say whatever, like it's not reliable.